Here I will discuss about healthcare delivery system. Healthcare concept and trends. Healthcare services of public sector including urban, private sector, public or private partnership or agencies, indigenous assisting medicine, Ayurveda, yoga, Vedic center and demography, voluntary health services and national health programs. Nurse role in healthcare services. Definition, concept and principles. Health, a state of complete physical, mental and social well-being, not merely the absence of disease or infirmity. Probably concept of health. Modern concept of health. Optimum level of functioning among individuals, families and communities. Trends in healthcare. Comprehensive healthcare, basic health services, primary healthcare. Level of healthcare, models of healthcare delivery. Tertiary level district hospitals, medical college hospitals, secondary level community health concern, Telika hospital, primary level PSC sub-centers. Primary healthcare. According to Alma Ata Conference, he defined primary healthcare as follows. Primary healthcare is essential care. Essential healthcare made universally accessible to individuals and acceptable to them through their full participation and cost that the community and country can afford. Elements and components of primary health care. Environmental sanitation, adequate supply of water and good waste disposal. Control of communicable disease, immunization, health education, maternal and child health and family planning. Adequate food and proper nutrition. Provision of medical care and emergency treatment of local endemic disease. Provision of essential drugs. Principles of family health care. Equitable distribution, community participation and the sector coordination, appropriate technology, focus and prevention. Equitable distribution. First principle. Health services must be shared equally by all people irrespective of their ability to pay and all its poor, rural or urban must have access to the health services. Communities participation. Environment of the individuals, family, communities in the proportion of their own health and welfare not usually at the government as essential component of primary health care. Inter-sector coordination. Primary healthcare involves, in addition to health sector, all related sectors and aspects of national and community development, and in particular agriculture, animal husbandry, food and industry, education, housing, etc. Applied technology is defined as technology that is scientifically sound, acceptable to local needs, and acceptable to those who apply it and those for whom it is used, and that can be maintained by the people by themselves in keeping with the principles of self-reliance with the resources of the community and country can afford. Focus and prevention. Health services should promotion health and health lifestyle, not curative only. Example, inhalation. Staffing pattern. Medical officer 1, pharmacist 1, nurse midwife 1, health worker female 1, block extension educator 1, health assistant female LHV 1. Staffing pattern. Health assistant male 1, UDC and ADC 2, 1 each, labor technician 1, driver if vehicle is there 1, class 4, total 15. Responsibilities of primary health care. Assessing the health levels of individual and community. Ensuring active participation of community and encouraging the individual to participate. Providing treatment in emergency and taking care of general health. Referring, training and supervising health workers. Keeping an eye on the outbreak of disease. Providing training and supervision of health workers. Coordination with the health programs, providing health education on preventive, promotive and curative aspects of health, maintaining and the progress of primary health care. Secondary care level. The next higher level of care is the secondary intermediate healthcare level. At the level more complex problems are dealt with. Care is generally provided in district hospital and community centers, which also serves as the first referral level. Curative services are provided at this level. Tertiary level. The tertiary level is more specialized facilities and attention of highly specialized health workers. This care is provided by the regional or central institutions, example medical college, hospitals, or Indian institutes, regional hospitals, specialized hospitals, and other apex institutions. Modes of healthcare delivery system: input, healthcare services, healthcare system, output, healthcare status and health problem, resources, curative, promotive, preventive, public, private, voluntary, endogenous, changes in health status. Healthcare service. Purpose of healthcare. The purpose of the healthcare service is to improve the health status of the population. Practices of good health services: comprehensive, accessible, acceptable, providing a scope for community participation, available at a cost the community can afford. Agencies of health care: public health sector, private sector, indigenous system medicine, voluntary health agencies, national health programs. Public health sector: primary health care, primary health centers, sub-centers, hospitals and health centers, community health centers, rural hospitals, district hospitals and health centers, specialist hospitals and teaching hospitals. Health insurance schemes: employees state insurance, central government health scheme. Other agencies: defense services, railways. Private sector: the private sector is polyclinics, nursing homes and dispensaries, general practitioners and clinics. Indigenous system of medicine: Ayurveda and Siddha, Unani and Tibetan, homeopathy and registered practitioners. Voluntary health agencies: national health programs. Family health care in India. 1997, the government of India launched a rural health scheme based on increase of people's health in people's hand. It is their entire system of healthcare delivery in rural area based on the recommendation of the Srivastava Committee 1975. Based on the heels of these recommendations and international conference at Alma Ata 1978 has set the goal of acceptable level of health for all the people in the world by the year 2000 through primary health approach. As a signatory to the Alma Ata Declaration, the Government of India was committed to achieving the goal of health for all through primary healthcare approach, which seeks to provide universal and comprehensive healthcare at a cost which is affordable, keeping view of a WHO goal of healthcare for all. By 2018, the Government of India installed a national health policy based on primary healthcare approach. The National Health Policy in 1983 laid down a plan of action for reorienting and shaping the existing rural health infrastructure with specific goals to be achieved by 1985, 1990 and 1995. National Health Policy 2000-2002 and National Rural Health Mission have been recently introduced to achieve HFO goals. Village level: one of the basic determinants of primary health care is the universal coverage and equitable distribution of health resources. To implement this policy at the village level, the following schemes are in operation: Village Health Guide Scheme, Training of Local Guides, ICDS Scheme, ASHA Scheme. Village Health Guide. The Village Health Guide is a person with an aptitude for social service who is not a full-time government functionary. The Village Health Guide Scheme was introduced on 2 October 1977. The VHD provides the first connectivity with the village and the health system. The guidelines for their selection are they should be permanent presence for the local community, preferable women. They should be able to read and write, have minimum formal education at least on the VI standard. They should be acceptable to all sections of the society. They should be able to spare at least 2 or 3 hours every day for community health worker. After selection, the health guides undergo short training the primary health care. The training is arranged in the nearest PSC at SC for 200 hours, spread over the period of 3 months. During the training period, they receive a stipend of ₹200 per month. Training. One completion of their training, they receive working manual and kit of simple medicine belonging to the modern and traditional medicine. They BSc are free to attend the normal vocation. Localized. Most deliveries in rural are handled by untrained guides. In local life, an extended program has been undertaken under the Rural Health Scheme to train all categories of local guides in the country to develop their knowledge in the elementary concepts of maternal and child health and sterilization besides the static stage. The training is for working 30 days. Each dies is a stipend of ₹300 during a training period. Training is given to PSC sub-centers or maternal child health centers for 2 days in a week. On the remaining 4 days of the week, they accompany the health workers to the villages practically in the dies owned area. During a training, each dies is required to conduct at least 2 deliveries under the guidance and supervision of the HWP and or HAPA. The emphasis during training is on sepsis is so that home deliveries are conducted under safe hygienic conditions, thereby reducing the maternal and infant mortality. After successful completion of training is provided with the delivery kit and certificate. The dies are also expected to play a vital role in propagating small family norms since they are more acceptable to the community. The national target is to train our local age leaders to undergo training in various aspects of health, nutrition and child development for 4 months. She is part-time worker with state and on ranging from ₹15 per month for the health attendant, which include health checkup, chart, inhalation and supplementary nutrition, health education, non-formal preschool education and diaper services.